Thousands of children and families in Marion County struggle with issues like poverty, substance abuse, or mental and emotional illness. Many local services exist to help families in crisis, but families often don't know about these services or can't get to them. Unmet needs can result in child abuse, neglect, or juvenile delinquency. The Early Intervention Planning Council, through the Marion County Commission on Youth's Early Intervention and Prevention Initiative, has created a plan to give families earlier access to services in the hopes of reducing the number of children who get abused or neglected or turn to delinquent acts. We hope you enjoy our monthly program, Our Kids, Our Families, Our Communities, and learn more about the local services here to help you.
Hello, and welcome to another episode of Our Kids, Our Families, Our Communities. My name is Shana Martin, and I'm the Director of the Early Intervention and Prevention Initiative at McCoy. All of our shows are focused on raising awareness about programs and services that can help children, youth, and their families to be successful. More specifically, our goal is to keep children and families from getting involved with the child welfare and/or juvenile justice system. Everyone wants a child to grow up in a home that is happy, healthy, and safe. Unfortunately, people face situations and challenges in life that often put children at risk of growing up in homes that are unhealthy and unsafe. Consider these facts. In Marion County in 2011, 31.9% of our children were living in poverty. 3,605 children were found to have been neglected. 477 children were sexually abused. 393 children were found to have been physically abused. There were 3,729 juvenile delinquency case filings, and 135 youth were committed to the Department of Correction. It is our hope that by raising awareness about supports and services available and by providing useful and practical information, that families are struggling and facing challenges can get the support and assistance they need. We all face challenges and at any given moment can find ourselves overwhelmed by all that life demands. Today's show is focused on 3 programs in Marion County that provide prevention and early intervention services. Prevention programs are those that are open to all children and families and focus on the development of protective factors. Early intervention programs help vulnerable children and families that have risk factors or are showing early signs of trouble to overcome the risks and enhance resiliency. Treatment programs are for children and families that demonstrate problematic behaviors and/or have become involved in one of the public systems already. It is our hope that more people can benefit from early intervention and prevention services simply by learning about them from watching this show. Our guests today represent 3 great early intervention and prevention programs in our community: Safe Families, Nurse Family Partnership, which is a program of Goodwill Industries, and NACS, Neighborhood Alliance for Child Safety, a program of the Children's Bureau. So let's go ahead and take some time to meet our guests. So if you ladies would go ahead and introduce yourselves and tell us a little bit about where you're from, and then we'll go into more specifics in terms of learning more about each one of your programs. So Lisa?
Thank you. My name is Lisa Harvey, and I am the director of the Neighborhood Alliance for Child Safety, and I'm originally from Dayton, Ohio, and I relocated here to Indianapolis in 2007.
Thank you. Thank you. We have another Lisa here with us.
Yes, hi, I'm Lisa Crane, and I'm Director of Nurse Family Partnership at Goodwill Industries.
Okay, thank you.
Marion County.
I'm Krista Davis. I'm the Director of Safe Families for Children in Central Indiana.
Okay, thank you very much, ladies, for being here. So Krista, we'll start with you. Why don't you tell us a little bit or all about Safe Families?
Okay. Safe Families is a voluntary program where a parent who's in crisis can place their child into a short-term, temporary, volunteer host home. Okay. So our Safe Families get all the same background checks as a foster family, but it's preventative, so it's before the kids go into the child welfare system. So our families are volunteers. We recruit them mainly through local churches, and we ask them to come alongside the families and help with whatever kind of situation is occurring, but mainly to put the kids into a safe place while the biological parents get their feet back on the ground. So the biological parents get their kids back as soon as they're ready. We don't take any kind of custody. So we love it when families come to us and ask for help and say, I just need, a few days or a few weeks, sometimes even months, to get this situation corrected. Things like homelessness, short-term incarceration, mental illness, hospitalization, domestic violence, all of those situations where a family just doesn't have the support they need to make it.
Okay.
And so it gives them a safe alternative for getting care for their kids so that they can work on the issues that led to their crisis.
Okay, wonderful. That's wonderful. So how does a family find you or get to you? Where are you located if they are in need of the services?
Well, our phone number is on Connect to Help. So if you forget our number, you can always call Connect to Help and ask for Safe Families.
Okay, and Connect to Help is 211, so if you dial 211.
Right. But our crisis intake line, is the area code's 317-519-3839, and a family can call and self-refer, or another caseworker who's working with a family can also refer to us. We have staff available to answer that line during normal business hours, but we also check messages in the off hours, so they can just call us up. And we're located at 71st and Benford Boulevard, but we have some satellite offices in other churches around central Indiana and some other areas around town, so we're kind of all over the place.
Okay. And serving with Marion County and?
Marion and all surrounding counties.
And all surrounding counties, okay.
We also have operations in other places in the state and in the nation.
Okay.
So we're in Fort Wayne, Valparaiso, Lake County, Southern Indiana, and Decatur County.
Okay, great. And I think the key there is that families voluntarily place their children with voluntary host families. So this is not a situation where the Department of Child Services is involved and there's no guardianship or custody or anything like this. The family says, I need some assistance. Can they help make decisions about which family their child is placed with?
We do a really good job of screening the needs of the child,
okay,
and also the qualifications of the host family. So because our host families are all volunteers, we just send out a call, who's available to take in these children,
okay,
and then we look and see what the best fit is. So we take into consideration their ages and their behaviors and the area of town that they live in, and we will make that match for them.
Okay.
But I can tell you our host families are all magnificent people. We've got about 250 host families serving now, and I think it's always helpful to just hear a little bit like a situation of when a family might use Safe Families. So one of my favorite situations is a young single mother who has several preschool age kids, wants to get a job but can't afford childcare, so she places her kids with us for 6 weeks. We connect her with our social worker and also with the host family, of course, who's an extra support then, and help her to get a job or get her connected to services that will help her find employment. And then once she gets her first paycheck and afford daycare, she says, okay, I'm ready for my kids to come home.
Okay.
She can visit her kids. She can talk to them on the phone every night. We encourage our parents to keep, being an active part of everything that's going on in the child's life.
Okay.
So it's a cooperative, just real loving kind of a placement. It's a voluntary. It's sort of like putting your child with an aunt and uncle or an extended family member, but a lot of the families we serve just don't have those extended family members that are able to help.
Okay. Or they're here by themselves and may not have extended family.
Exactly.
Yeah. Okay. Well, great. Well, thanks for sharing that.
Sure.
I'm sure we may have some other questions and come back and learn more about Safe Families.
Okay.
But thanks.
Thank you.
Mm-hmm. Lisa, you want to tell us about NFP, Nurse Family Partnership?
Yes. Nurse Family Partnership is a national program. It was developed, originated in Colorado, and it is a nurse home visitation program in which bachelor's prepared registered nurses visit a first-time mother. Nurses begin the visits early in pregnancy and continue those visits until the child turns 2. The eligibility requirements for moms include first baby. They must be low income, that is eligible for Medicaid, and they need to live in Marion County right now. We're serving in Marion County. Our funding comes for the implementation through Goodwill Industries, and our funding comes through the through the State Department of Health. It's federal funding. Our nurses visit moms weekly for a few weeks, and then they visit every other week until the baby's born, and then they go back to weekly visits for about 6 weeks, and then every other week until the child turns 2.
Okay.
we are the first implementation of nurse-family partnership in Indiana, but it exists in 44 other states. So it's a pretty large program in the country. It is evidence-based. It's based on about over 30 years of research. And so we have a very strong model that we follow. Currently in Marion County, we are implemented by Goodwill Industries, which is a real perfect fit. Our mission with Nurse Family Partnership matches the Goodwill mission very closely. We have enrolled, up until now, we have almost 400 active moms in our program, and we have funding to enroll 600 in Marion County, so we have plenty of open spots. We currently have 22 nurse home visitors who are visiting moms, and we will build to 24, so we're almost at full capacity in terms of nurses. Our nurses take 25 clients in their caseload. All of the intervention, all of the work that they do with mothers is in the home. And so they visit within the home. We like to say we're client-centered, strengths-based. So what we do is, instead of bringing a curriculum and telling the mom what we want her to know, we ask the mother, what do you want to know? What do you need to know to have a healthy baby, to take care of your baby? Our goals are simple, and they're just threefold. We want to improve birth outcomes. We want to increase and improve the health and development of infants and children, and we want to improve self-sufficiency. And that's why Goodwill is a perfect match for us. We are working in collaboration with Goodwill Guides, and they are professionals who can join with the family, not only the mother, but her supportive partners, other members of her family, grandparents and things, and connect them to education and employment. We have lots of strong community partners with which we can do that. And as you well know, Goodwill has jobs. We also have adult high schools and the Met High School. So we can connect those family members, those mothers, with that education as well.
Okay, great. Lisa, how does a expecting mother get to you? How does she find out about Nurse Family Partnership?
Sure, yeah. Well, our program is free and voluntary. So moms can self-refer, that is, call us on their own. Many of our referrals come from clinics, and others come from schools because we have no age limit. We can serve the very youngest new mother or the older mothers. They can call our office at 524-3999 and just let them know that they're interested in being in our program. We do need to enroll them by the 28th week of pregnancy, which is about by the time they hit 7 months. But we like to enroll them as early as possible. So many times moms will call us when they first find out they're pregnant and need some support. And we can do that. Our nurses are great at helping moms find good prenatal care, enroll in Medicaid, and just learn all of those things and answer all of those questions you have when you're newly pregnant. Additionally, at goodwillindy.org/NFP, people can go on, and if you want to refer online, you can do that as well.
Okay, great. So then a mother has an opportunity to have a nurse visit throughout the pregnancy,
Yes.
but then for 2 years as well, and being connected with Goodwill gives them access to lots of other services, including kind of case management through the Goodwill Guides, but access to employment opportunities, and also the Indy Met High School and the Excel Center, which services high school diploma for those who are over the age of 18, correct, or have dropped out of school. So really great opportunities and great programs. And I know that Goodwill has also lots of working partnerships with lots of other organizations and community partners. So thanks for sharing.
Yeah, thank you.
Okay, my other Lisa, tell us a little bit about NACS.
Okay, well, NACS was developed in 1999 in partnership with the Department of Child Services. DCS was getting a lot of calls concerns within the community, and so they wanted to try to develop a way to prevent children from coming into the foster care system, and that's how NACS, Neighborhood Alliance for Child Safety, was developed. And what happened was they developed this particular program as a prevention in order for individuals in the community to be able to have resources. And so what they did was they hired several liaisons in the beginning to go out to the homes, do home assessments within the home. The program is actually totally voluntary, so they're not obligated to sign up for services in any way, shape, form, or fashion. They can sign up for services, and then they can receive resources from our liaisons within their community. We are actually serving the whole entire Marion County area, and we actually have 4 locations. Okay. So we're located north, south, east, and west. So what we did was we trying to make sure that it's convenient, because we know a lot of our families don't have transportation. They have transportation issues, so therefore we want to make it as convenient as possible for our families to be able to get those services. So in the event they need to come in to use a computer for a resume building and things like that, they will have easy access to that, so they won't have to travel all the way on the other side of town to get to one of our buildings. So therefore we tried to make it as easily accessible for our clients as possible. We actually provide them resources as it relates to counseling services, food, clothing, shelters, housing. We actually help them, like I said, with job preparation, creating their resumes, a whole plethora of different resources we can provide to them. A lot of our clients don't know that those resources are in their community, so therefore we make sure we give them that information that they need to have. So our ultimate goal is for the clients to be self-sufficient. We usually have our clients for about 90 days, sometimes kind of depending on what their needs are. We have them for a little longer, and our clients develop their own goals. We don't tell them what their goals are. It's a very strengths-based approach, so therefore they let us know what they're in need of, and based on those goals we work with them to be self-sufficient, and hopefully they'll be able to retain that information and be able to utilize that information a year or 2 years down the line, hopefully if those resources are still there. If not, they can always refer themselves back to our program again, so it's not like we just cast them out and say, you know, we're not going to work with you anymore. They're more than welcome to re-refer themselves to the program again, and we can get them some different types of resources if those resources are non-existent, because sometimes, as we all know, things happen and organizations go out of business, so therefore we're always up, and we're always making sure that we keep our resources up to date. We actually have probably about 12 liaisons on staff now, so therefore we have enough individuals in the community that can service these clients. We serve probably around 1,000 families a year, so therefore we try to hit all areas of Marion County to try to make sure that we're out there and we're actually talking to people about our resources. Anyone can refer themselves to the program, so we can get referrals from hospitals, daycares, churches, community centers, anyone. You can do a self-referral. Okay. Also, you can refer yourself to the program. There's no income guideline for the program. The only stipulation for our program is that you can't have an active open case with Department of Child Services, and you can't be involved with Healthy Families at the same time, because sometimes we don't want to have a duplication of services. So therefore, we want to make sure that they're not getting services through Healthy Families, and we serve families. We serve children from 0 to 17.
Okay. And when you say families, is that defined kind of loosely? Can it be an aunt that's maybe taking care of her nieces and nephews, or a grandmother that has custody or is taking care of grandchildren and just needs support and services, or does it have to be a mom and her children, or a dad and his children, or
right?
How is that kind of defined?
Well, we always make sure they have at least one child in their home.
Okay.
That is a must. You have to have at least one child in your home. And so we come across grandparents all the time, and so we have aunts and uncles, and they're taking care of their nieces and nephews and things of that nature. So as long as they have at least one child in their home that they're caring for on a full-time basis, okay, we can service that particular family.
Okay. And NACS also has some other services that work specifically with fathers, and then also CCDF. Do you want to talk a little bit about those components?
Yes, we actually have, we work closely with Forever Fathers, and it's also called Father Engagement Program. They're two separate programs based on the financial, from the state. You have one that's considered grant money, So therefore, there's two separate pots of money. So therefore, there's Forever Fathers and there's also Fatherhood Engagement. And Fatherhood Engagement is actually one set of programs. They serve individuals that cannot have a case with DCS, and the other one you can.
Okay.
So therefore, those are the big differences between the two programs, and they actually target the fathers, and they work with the fathers in developing a relationship with their child. Even though that they may not actually be in the home with the child, they can develop a relationship with the child. And also they work with fathers that are incarcerated as well.
Okay.
So they want to make sure they're able to keep that relationship with the child. Even though they're incarcerated, they can still have that connection with the dad, because we notice a lot that there are kids that are acting out and things like that because they don't have a father figure. So therefore, we're developing initiatives and putting programs in place that will be able to better serve the dads.
Okay.
And we know that that is a big issue and that's a big need. So therefore, we're doing everything we can within Children's Bureau to develop programs that be able to better service the dads. And with CCDF, we actually, one of our NACS offices also has a CCDF office located within the NACS program. So therefore, anyone that has issues with CCDF is trying to sign up for child care services, they can actually come to one of our NACS sites, which is located west off of Crawfordsville Road, and they can have an application, they can sign up for services. And right now, I'd say the waiting period is maybe about 2 or 3 weeks to get on CCDF. So the turnaround is really quickly now, versus in the past it used to be months and months and months.
Yeah.
So now it's been about maybe 2 or 3 weeks, a turnaround for getting child care.
Okay, great. Well, thank you. Well, since this show is all about kind of preventing kids and families from getting involved in the system, how effective are your programs at doing that? And how do you know that your programs are preventing families, by the services and the support you provide, are keeping families from having to deal with Department of Child Services or probation or courts and that kind of stuff? Or anybody?
Well, we do track our placements and we set placement goals. And because we have a social worker on staff that supervises all of the cases, we monitor, the progress of a family. And we're really proactive about trying to become a longer-term support for that family even after the child goes home. So number one, we're working pretty closely with the family while they're trying to resolve their issues that made the child be unsafe at home or had some gaps in what the family and child needed. So we're pretty hands-on in seeing what kind of progress a family's making. And then also just I think that built-in support afterwards tells us that the family has another safe alternative when they need help. We get a lot of families that call us back and ask for another placement. So they may start out needing a job and then they need housing that's big enough for their new baby. And so can we help out with those kinds of situations because they're about to lose their housing and place their kids then. So just the fact that we're following them along. We have a 97% reunification rate of our kids with our biological parents or extended family.
Okay.
So there's only 3% of the kids that either don't go back home because they go into CPS, or sometimes they age out and go off to college. Maybe we've had college kids high school kids that are transitioning to college and needed a place for the summer that didn't have a safe place to live. So that 3%, part of that is DCS, but a very small portion. The other part is those kinds of things. Maybe it goes to an adoption somehow or something, but really high reunification rate, that's our goal.
Great.
So.
Okay.
Yeah, and for our program, we track outcomes very closely. Our model was developed based on those randomized controlled trials that I talked about, and some of the data that came from that research was reducing by almost 50% child maltreatment in the children who received NFP services in those families. And in fact, Dr. David Olds, the founder of NFP, has tracked outcomes to age 16 and beyond, has found a reduced rate of involvement in the juvenile justice system with the children, has found a reduced rate of incarceration among the mothers who received NFP. We're a relatively new program. We just really got our feet on the ground enrolling moms in January of 2012. So we've just been, just a little over a year. We have about 250 babies right now, though, in our program. So, and we track outcomes. We track about 2,000 data points throughout the engagement with the moms, and are reporting the outcomes to the community, to our board, certainly to our national office. We expect to have those great outcomes. We have very encouraging birth outcomes up till now. So, but we are certainly all about outcomes and tracking.
NACS has a service standard that they have to adhere to, and what that service standard is that about 98% of our clients have not had an active open case with DCS once they are referred to our particular program.
Okay.
So we track that, so it's 98%. So I think right now we're doing really well.
Wow.
So we hope to keep up that momentum and making sure we provide those services for our families.
Okay, great. Well, any last thoughts or comments or information you want to share with the viewers about, the services, about the importance of prevention, about asking for help? I mean, maybe tell a little bit about some of the families that come to you and what they look like, so folks know that, again, it can be anybody, and at any given moment, any of us can find ourselves in a crisis situation for various reasons, and asking for help is okay, and in a lot of cases keeps their kids safe and keeps the family together longer and provides for more stability. So do you want to share a couple stories with us, maybe?
I can
Sure.
mention a little bit about the families that we're serving right now. We are serving, as I said, we have no age limit. The youngest client that we've enrolled was 12. And the oldest client, it was her first baby, is, I believe she's 39. So we have the gamut. We have served moms, obviously, who are still in high school, girls in high school. We have served a few of our moms that are enrolled actually have college degrees. And our nurses are helping them get their goals in line. Perhaps they've had a pregnancy that was unexpected and kind of caught them off guard, and the nurses are there to kind of help them get their goals on track and help them learn how to reach their goals and take really good care of their baby at the same time. Additionally, I did want to mention that about 20% of our population are Hispanic. And 13% are Spanish speaking. We have bilingual nurses, several of them, about 4 right now. And we also serve some of the Burmese refugees, particularly on the south side. Fortunately, we have resources to have interpreters, so if there's a language that we need, we've served African moms. And so I think the gamut, and I would just encourage, if anybody knows a neighbor, friend, anybody who's expecting their first baby who could use some help and would like to have a nurse visit them, to call us. So,
Okay.
yeah.
Good, thank you. Lisa, do you have a quick story you'd like to share with us?
Well, lately we've gotten, just like she said, a whole gamut of referrals, but we have some that, the 2-parent households, and we're making a decent amount of, income, then all of a sudden they were laid off for whatever reason and just kind of wiped them out. And so, like I said, with it not being any income guidelines to it, it's a good thing, because we do have those families that make a fairly decent amount of money, then all of a sudden something happens and it just kind of takes the wind out of you. And so a lot of times they're a little too proud. They feel like they're too proud to make a referral and say they need help, but that's what we are there for. And so we are able to help those particular families get back on their feet. And we've seen that quite often. We've seen a lot of families that go through domestic violence. So we're seeing a lot of that. Probably, I would say a lot of our families have been Spanish speaking that deal with a lot of domestic violence. We do have 3 Spanish speaking liaisons that are on staff. So therefore, anyone that knows anyone that's Spanish speaking can refer clients to our program too. If they need to call, we do have someone that is a Spanish speaking administrative assistant that can help them as well. So I don't want that to be a barrier. We're trying to remove as many barriers as we can in our program, so we're trying to diversify our staff as much as possible. But for the most part, I would say we have single parent families, a lot of single mothers that have moved from different states and trying to start over.
Okay.
And then, of course, they don't know about, Indianapolis, they don't know about the resources, housing and things like that. So I would say a good majority of our families are single mothers just relocating from different parts of the United States, trying to start off fresh and new, and can't just seem to get their feet on the ground and get rolling.
Yeah, it's tough when you come from one place and trying to adjust to another,
Yes.
especially when you've got
Yes.
children and family and all those responsibilities.
Exactly,
So,
and that's when the child care comes to be an issue.
Yes,
So we're helping them
definitely.
sign up for CCDF, and so I think it's a good thing that we have that component and we have that ability to help them with CCDF and help them get started and help them get a job, and just like baby steps, one step after another.
Okay. All right. Well, thank you, ladies, very much for being here. Really appreciate it. Lots of great information that was shared with our viewers, and I just want to thank all of them for tuning in to another edition of Our Kids, Our Families, Our Communities, and we look forward to seeing you again for our next episode. Thank you very much.